Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about trouble signs in baby. As a new parent, you may be unsure what's normal with your baby. You may not know when to call the doctor. Trust your instincts. If you feel something may be wrong, call the baby's doctor. Be alert to the following signs and symptoms. Call your baby's doctor if she experiences any of these symptoms. Has difficulty breathing, has difficulty feeding, has a bruise or bump on her head, vomits after most feedings, especially if vomit is brown or green or is ejected with force, if you see mucus or blood in her stools, if she has diarrhea after each feeding, if baby doesn't have a bowel movement during the first week, if she has a fever of 100.6 Fahrenheit or higher, appears yellow, it could be jaundice, or if she looks or acts differently, such as extreme lethargy and sleepiness, or is highly irritable and very pale. Contact your pediatrician if your baby sleeps longer than 6 hours, is hard to wake up, or skips more than 3 feedings. Repetitive movements in your newborn that don't stop when you hold her are serious. Call your doctor immediately. Baby's soft spot may also alert you to illness in baby. If it remains sunken for longer than a few minutes, it may be a sign of severe dehydration, especially if accompanied by fever, vomiting, and/or diarrhea. Take your baby to the hospital immediately. Babies born between 35 and 37 weeks are prone to some problems, especially in the first few days after birth, including breathing problems, jaundice, low blood sugar, infections, and nursing problems. If baby has trouble breastfeeding, your doctor may suggest supplementing breast milk with formula for a short while so baby doesn't get dehydrated. Babies often spit up or vomit a little. It takes time for their digestive tracts to function normally. However, some babies experience recurrent or forceful vomiting called projectile vomiting. The main symptom is forceful ejection of milk, formula, food, medications, water, or anything baby swallows. The problem may have several different causes, including illness, flu, or digestion of a food or medication. You should be concerned if baby experiences projectile vomiting, she doesn't gain weight, or she cries when she spits up. Other trouble signs include trouble breathing or coughing a lot, fever, diarrhea, constipation, blood in the stools, or lethargy. Contact baby's doctor. Until baby reaches 12 weeks old, anything out of the ordinary can qualify as a possible emergency. That's because baby's immune system hasn't matured and cannot fight infection. It's up to you to keep a close watch on baby. The best advice we can give you is to trust your instincts. If you believe there's a problem, call your baby's doctor. He or she will advise you. Don't worry about calling the doctor. Your pediatrician and his or her staff are there to help you. Your questions won't sound silly. They've probably heard any question you may ask many times before. If you'd like to read about baby, check out our book, Your Baby's First Year, Week by Week. We cover many subjects dealing with baby in a weekly format. Each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It lists topics about baby covered in our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and other important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.